All right, now joining us now for an in-depth discussion is the Health and Allied Workers Indaba Trade Union's first Deputy President, Molatedzi Ramaano. Molatedzi, good evening and thank you very much for your time. So you handed your memorandum yesterday highlighting a number of issues, among them being the non-absorption of COVID-19 workers. Just talk us through your grievances.
Yeah, thank you very much and good evening to you and the listeners. We were deeply concerned about the contract workers that have been recently terminated due to the reasons known to the department. So we took a step as Health and Allied Workers in our trade union to say we are going to take the memorandum to the Department of Health and Allied, to the Department of Education, to the Department of Health to see to it that they absorb these contract workers that they have been terminated. And again, we have took to them to say, please make sure that all the vacancies that are more than 700 are filled with immediate effect, because there is gross shortage of staff in all the hospitals in Limpopo. Again, we have written in our memorandum to say we demand that all the nurses that have developed themselves, that have leveled themselves up to be registered nurses, that are now working as staff nurses, to be given chance to work and being absorbed as registered nurses. We also demanded that.
You can continue.
We also demanded that. Yes, we also demanded that all the night shift allowances or the night shift overtimes that the nurses have worked since the COVID started need to be paid immediately. Also to say the department needs to train the nurses to curb this gross shortage of staff, and also to make sure that all the acting posts that are there in Limpopo, because lots of managers that are in Limpopo are in the acting posts. So we need them to be absorbed, because the department could see and have a need that they need these managers. So they need to absorb them as soon as possible. We also demanded to know that the money that the department have returned, why have they returned the money, yet they know that they've got vacancies, and yet when we ask them, they tell us that no, we do not have funds. And why have they returned more than 526 million rands to the treasury? Why is the returning of the money? Also demanded that they should not force 24-hour clinic operation before they see to it that that certain clinic that they are forcing for 24 hours has proper working equipments and also human resources, because most of the clinic don't have electricity, don't have backups. So we have demanded that the clinics should be in a proper working condition before they open for 24 hours.
All right.
We also demanded that
I just want you to paint us. Apologies for interjecting there. I believe we will be running out of time quite soon. I just want you to paint a picture for us of how the shortages have affected the overall health system in Limpopo.
Look, the shortage is deadly. It's too much, because you find out that maybe in the hospital where it is maybe 59 bedded, there is only 4 nurses that are working, maybe in the evening night duty, seemingly, or maybe when we're checking nurse-patient ratio, there should be maybe 16 nurses nursing 50 patients. But because of shortage, you find that the number is halved, or just only 4 nurses versus 50 patients. So these have led to a burnout to the nurses, and also including death to nurses and also to the patients. So we are saying to the department, can't they at least save lives, because patients are dying. We are used as instruments of killing patients. unintentionally so, because the government doesn't want to hire nurses. And we are saying to the government, can't they at least train other nurses? Because nurses that are trained in Limpopo, they are all over the provinces. They are working in Gauteng, they are working in Mpumalanga. We want them back. We want the Department of Health in Limpopo to employ their nurses. It's just that it's a pity that lots of hospitals and lots of clinics are operating under pressure. They don't have human resources and they don't have material resources. Managers are going around doing the so-called benchmarking. They're saying we are benchmarking if in the off duties. They are now rubbing in and forcing in the off duties to say nurses should work off duties that the managers think is suitable for nurses. Yet the nurses, they know what is suitable for them. This benchmarking should stop, because they go benchmark to the hospitals that have got enough resources, that have got enough human resources. So we're saying to the government, when they go and benchmark, they should also benchmark the number of nurses that are there, the number of staff that are there, because most of the hospitals, say for example in Gauteng, they also utilize agency nurses, they also utilize overtimes, where in Limpopo, they are killing overtime, they are forcing nurses to work those off duties that are not suitable for nurses, that are killing nurses and killing patients rather.
What is the status of the COVID contract workers? Because we know that their contracts came to an end at the end of June. Where are they now? What's happening with them?
They are seated at home, they are roaming around, because their contract was supposed to be ending next year, since it was a 5-year contract. In other provinces, the contracts are still going on. They are still going on, I think, till next year, April. So with Limpopo province, they've terminated to say there is no longer COVID, which I think it's a lie. It's a lie, because last week they were saying, people be careful because COVID is still there. Even next week, if we can check, they will still be telling us that COVID is still there. But because they want to save their interests, that's why now they are saying COVID is no longer there. Now the contracts is finished. Now they put them in measles contracts, wherein they also say measles is no longer there. Now we no longer want them. So we are saying, because they've seen it fit to utilize them for 4 years. So we are saying they are as equal as nurses. All the contract healthcare workers, we need them back, because there is, look, other hospitals, they don't have porters. You find that the disease, the bodies of the patients are lying from maybe 6 o'clock around the evening till the morning, because there are no porters in the hospital. And that is disgusting, because it gives stress, it brings stress and depression to nurses, nursing patients, even to patients, because you see dead bodies lying around because there are no porters. I'm talking about the regional hospitals, the referral hospitals that are around Limpopo.
A very disturbing picture that you paint there. Molatedzi, thank you though so much for your time this evening. That was the Health and Allied Workers Indaba Trade Union's first Deputy President, Molatedzi Ramaano.